This is Inside Sports Medicine with Dr. Jeff Pierce, Steve Olson, certified athletic trainer, and your host, Dominic Hennig on 97.1 The Ticket.
It is Inside Sports Medicine with Dr. Jeff Pierce, broadcasting to you live on a holiday weekend. Happy Memorial Day to you. Dr. Jeff Pierce is in studio. Steve Olson is gone remote, not tuned in today. He's gone for the week. Dr. Dana Ponders is joining us from the OMPT specialist. My name is Dominic Hennig. Busy show as always. Coming up, we're talking about the hip today. Hip injuries, hip pain, basic causes, treatment, and recovery. Before we dive into the injury report, we do have the medical updates coming up in the second segment. The medical minute, more so referred to. We'll get to the Starfish Family Services for our local hero of the month, Marissa Nicely, the VP of Clinical and Youth Services, will join us. Ben Bowler from Forever Labs is in studio with us today as well. We'll get to the regenerative medicine regenerative medicine minute with Ben coming up around 8:30 time. Before we dive in, though, to the hip pain, we are taking your phone calls. Hey, if you have questions regarding the hip today, if you're too busy during the work week and have a minute to call in, we'd love to hear from you. 248-539-9797, 248-539-9797. Ticket text 97136. Dr. Dana Ponders, Dr. Jeff Pierce, happy Memorial Day. How you guys doing today?
Happy Memorial Day.
We're doing great. Like you said, this is our second holiday weekend, and we're having fun. Looking forward to Father's Day coming up, too. But we're working. We're loving this show, and we want to really focus on getting the feedback of the people. I mean, the listeners, we're getting feedback on, I've heard everything. I want to hear more about the medicine you're talking about. I want to hear more from Chris Draper. I want to hear more from the people you've worked on. So we really want to start teasing out what your interests are, and we want to make sure we're solving that. So that's kind of our big message today. We're going to have some fun in the studio today for the long weekend. So hopefully some more people are up to today, but they might be sleeping in a little bit.
Well, speaking of sleeping in and long weekend, Steve Olson gone from the show today, and of course we're going to miss him here, and I'll be handling the injury update, and I'd love to have the insight from you two as well. Where is Steve?
He says he's so far away he can't get even reception. So for him not listening, we can really pick on him. And any issues that we have today is Steve's fault. So.
How good does that sound? No reception right now. Well, let's dive into the show here today, the injury update. And I'm going to do my best to fill in for Steve. Typically not my area of expertise. We'll dive right into it here. And we'll start with the Tigers. And the Tigers had the catcher, James McCann. He's on the 10-day disabled list with a left-hand laceration, and McCann needed 5 stitches in his left hand after getting hit by a pitch Thursday against Houston. His roster spot was absorbed by John Hicks. Alex Avila will see most of the action behind the plate during McCann's absence. Hicks will be making an appearance here and there. McCann shouldn't miss longer than the minimum 10 days. They say it's a deep cut in his hand. And either Dr. Jeff Pierce, Dr. Dana Ponders, left-hand laceration. For those not unaware, I mean, how does that happen in baseball, or what have you seen in the past in your dealings, with lacerations?
It's a little bit different in baseball. There's supposed to be less contact, so it's kind of a freak injury. We don't see too many lacerations. Obviously, hockey, we're seeing a lot more of those issues. So I think it's just an unfortunate thing. It's not a common thing that we see. It's a lot of contact or something like that. But this time, I think he got hit in the hand.
I think the most important part of that is how deep is the laceration, because if it's going into the tendons of the hand or the wrist, it can be a big problem and a long time that he might be out. If it's more superficial in the skin, it's a shorter time that he could be out of the game.
Yeah, so we're assuming with this one, obviously that's right, but it's probably a little bit more superficial. I don't believe there's a tendon tear, because it wouldn't have just been 5 stitches. It would have been a little bit more involved, and it's going to go through all hand rehab and things like that. But I think right now, you're right. The deeper it is and the more involvement of the layers, it's going to extend that injury and put you through an intensive rehab program, especially with a catcher whose hands are so important, any batter for hand speed and things like that. So, yeah.
Let's stick with the Tigers here. Right fielder Jim Adduci, right oblique, placed on the 10-day DL back on May 12th. As of Thursday, May 25th, he was doing light throwing. That's 13 days later. I read an article on that. He said he feels like someone's punching you in the ribs. That's how he described his right oblique strain. What have you seen in the past regarding that?
Well, we talked about it last week with Cabrera. I mean, it's oblique. Where is your oblique? I mean, that's really the question. And we talk about the core muscles for the body. Everybody knows their belly muscles, their abs, their back muscles, their paraspinals, their glute muscles, their butt muscles. But what are the obliques? Those are the things that come down your ribs and into your belly, and they're the rotational muscles. So he's right with a bad tear, which he's probably having more extensive than some of the other players. It does feel like it's someone's punching in the ribs, or with any side-to-side movements or rotational movements, it's going to aggravate that area. And it's not a big, thick muscle like your bicep, things like that. So it's delicate, and you need to be careful of it. It's just one of those silly little strains. I mean, Danny, you've rehabbed. I know with our patients together, it's always important for the back muscles to have the obliques involved. So any special hints to rehab that a little bit quicker for our listeners?
Well, oblique problems are definitely muscles that do get strained with rotational sports such as baseball and in hockey. And as you have mentioned, it is kind of a delicate sheath. It's a long muscle. It's integrated and it has a lot of other layers into the rectus abdominis, the one big muscle that everybody likes to work out. So most muscular injuries...
That's your belly muscle, folks.
It's your belly. One of them, that's for sure. Most muscle injuries take, again, a time frame to heal wherever you are in your body. Again, rest and not overtraining that muscle at this point. Kind of letting it rest is going to be the most important thing, I think, at this time.
Which is a good point. I mean, I'm not big on rest, but you can't keep irritating those fibers. So it does have to be put in a protective thing. It's not like we can cast it or brace it. It's hard. So again, it's one of those aggravating injuries that you don't think much of it, but it does take its toll on you.
And Dr. Pierce, this is a good lead into the topic of the day, the hip.
Oh boy.
Other things that you can do while you are resting the obliques and also do play a part in rehabbing the obliques is hip muscles, because they all blend in that area of the abdomen also.
Yeah.
So things that, any patient or player or client can work on is hip muscle strengthening instead of, again, tagging those obliques for the next couple weeks.
Which is true. I mean, we do teach the players, in this case, early in the season, we want to make them stronger overall. So why did that oblique even get hurt? And it could be a muscle imbalance. And you're right that we really want to focus on, around the hip, around the glutes. Let's make sure everything else is working. When we say rest, that doesn't mean you just sit and lay in bed. You're going to work on other areas that aren't going to aggravate the injury. But definitely, just from cardio or upper body or lower extremities, that's what we want you doing. And it's not really resistant workouts. It's kind of like full body workouts. Even like the yoga poses, core poses. We can talk about Supermans. Well, I think we'll save that for the second segment. We'll get into all that stuff.
Well, let's move on to the NBA here. Patrick McCaw, he tweaked his right ankle in Monday's Game 4 win over the Spurs, probable for Game 1 of the NBA Finals. We're talking Golden State here, and then Zaza Pachulia, right heel contusion in Game 1. Your guys' thoughts on what you've seen in the past in the NBA and patients that you've handled with a right ankle tweak and a right heel contusion?
Well, again, I mean, we're in the playoffs. I mean, these sound like little minor injuries, and these guys are getting paid millions and millions of dollars. Toughen up and play the game. And in a lot of ways, that is what's going on right now. You only get one chance at the finals, and being healthy, and there's things we can do to get them through the game. I don't think either one of those injuries are going to be, season ending. So we want to be able to do it. And then, they're doing, I know they are using PRP and things like that, which we'll talk about later, but there's new methods, and it's not just steroid injections to get them in. A contusion, for a couple hours of the game, you find a way to create a cushion for that contusion. Hopefully you can weight bear. It is your foot. Foot's a major part of it, but again, these players are, they get through it.
NHL here, Ryan Johansson, he's out for the season with a thigh injury with the Nashville Predators. He needed surgery. The husband of Carrie Underwood, Mike Fisher, eye injury in Game 4. I wanted to get both your opinions on this. He did not play in the deciding Game 5 win over the Anaheim Ducks on Sunday. He's maybe going to be back Monday for Game 1 of the Stanley Cup Finals. First off, Mike Fisher, what a life he has going on, living in Nashville, married to Carrie Underwood. But the injury that, when we were prepping for the show this week, I sent you both the link. He's going to the net hard. It seems like the right knee from the Anaheim Duck defenseman hits him as Fisher's going to the ice. They're calling it an eye injury. Do you think that's a deference away from a concussion? What do you see there on the injury on Mike Fisher, the Nashville Predators?
You're really starting to try to be controversial here, and you're not going to pull me in.
Hey, it's
on that
good radio.
So, yeah, you look at it, there was rumor he did have a concussion or a head injury, and it turns out to be an eye injury. And it could be either one. I'm sure it's a combination of both. I'm not going to say he got knocked out. He did look a little woozy coming off. It was a hard hit, and that's what we can say is that, with a player, you're worried about if he just gets hit into the eye socket, creating blurred vision. It could be as simple as that. I don't think there's any major lacerations to the eye or things like that. But, with the concussion, there's different rules and regulations now they're following. So I don't want to say that the eye injury appeared with some other symptoms, but I think we're going to keep it simple that we look forward to him playing and enjoying his life in Nashville at this point.
Dr. Donna?
Well, I concur with Dr. Pierce on that. An eye injury is kind of an odd injury in hockey, but again, possible.
Yeah.
And I also have a tendency to think about the speed of which players are hitting and then the pads. It seemed like it might have been a knee pad or a hip pad that kind of can hit in that area, but it's kind of a blunt instead of a pointed area to hit his eye.
We do got to get to a commercial break here. I know real quickly Pittsburgh's Patrick Hornquist, he's out day to day with an upper body injury. Then Chris Letang out indefinitely with the neck injury. Coming up in the next segment, the Medical Minute, and we'll also hear for the Starfish Family Services for our local hero of the month. We're talking hip pain today, taking your ticket text 97136 on ticket text. Questions for the hip pain. Got two doctors here, over 20 years of experience each. 97136. Dr. Dana Ponners, Dr. Jeff Pierce. My name is Dominic Hennig, and this is Inside Sports Medicine with Dr. Jeff Pierce.
This is Stephen Klaus.
The basketball team the Detroiters love most. The Detroit Pistons live here. Now back to Inside Sports Medicine on 97.1 The Ticket. It's time for the Medical Minute, sponsored by Superior MRI.
It is Inside Sports Medicine here. Time in now for the Medical Minute. We're talking hip pain today. Basic causes, treatment, and recovery. Doc, what do you got for us today?
Well, we've been pushing on hip, and Dana's here pushing on the hip and all the muscles around it. But it is a common injury. Everybody hears about their loved one who's had a hip replacement. Our goal in our treatment program is to try to prevent that. Kind of those early injuries, younger in your years that you've had therapy for, things like that. Before it was, steroid injections, medications. It's a hard joint to treat. It's not like your knee or wrist where you can kind of use creams and ice and have full effect. You can ice the hip for simple injuries, or people hate the ice. They'll use heat. But overall, I really want to push what we're going to talk about in the third segment is that's why I'm so excited about regenerative medicine, is that we're starting to be able to see true growth in rehab of the joint itself, meaning we're seeing better surfaces. We're seeing the ligaments improve. We're seeing the muscles improve with the stem cells and things we call PRP, which is what we pull right from your body. And again, we'll get into it more in the third segment, but prevention is key. That little injury early on is what we want to take care of. You might recover in 2 weeks and do well, but the problem is that you've already had that first injury. What does a first injury cause? We all hear about the term arthritis. I love the term arthritis because it's easy and everybody has an arthritic hip, but that's not really the diagnosis. That's a diagnosis we kind of use to kind of blanket everything. But there's so much structure in the hip itself. Dan, I mean, we've talked about, the joint itself, the ligaments. We're now, we're improving the skill of improving what we call the labrum of the hip, which holds the hip joint in tight. Then you have large muscles around it that kind of strengthen the hip and then the joint itself. And then the hip, as opposed to the shoulder, is taking on so much pressure. I know we talked about pre-show that, we don't want to pick on overweight people or anything like that, but I just want to make you realize for every pound you're overweight, you're putting 4 to 6 pounds more of pressure on the hip. So when we ask you to take off 10, 15 pounds, we're taking off a lot of pressure on that hip, which is what we're calling regenerative, simple regenerative versus the chemical of like stem cell and PRP. We're trying to avoid steroid injections these days. There's a lot of literature coming out that steroids may solve the issue, but the long-term effects are a problem. So really in our generation, we're really looking what's down the road and what's going on and how we can prevent it, which is a lot what we do in the practice. I mean, we call ourselves preventative medicine. We love the term regenerative preventative medicine is really what we're pushing. So I know Dana's biting at the mic here to get in on her muscle structure around it. But it's true. I mean, a lot of hip injuries are back injuries too. And we talked about back last week. But hip, there is some structure. Everybody went, it deteriorates, we'll replace it because they perfected the hip replacement and they perfected the knee replacement, which I totally encourage for those who need it because the technology's improved. But I think what we're trying to do in our practice is prevent it. So if you're that person that had a little tweak younger in age, the football player with a hip pointer, I was limping for like 2 weeks, couldn't really put pressure on my hip. We want to see you. We want to talk about doing a stem cell. We want to talk about storing your stem cells, which we're going to get more into in the third segment. So, Dana, what do you think about this?
Before we dive into her, ticket text 97136. We are taking your ticket text. We're talking hip pain today. And again, we have two doctors here who have 20 years each of experience or more. Sorry to discredit you. 248-539-9797. 97136 if you do have a question on hip pain. Just, Dr. Dana, some of the causes that you've seen from basic people, runners, and people maybe even non-athletes that have come in that have hip pain. What are the causes been?
Yes, that's a very good question. And everything that Dr. Pierce said is actually the trend that you do see is that, first of all, people are coming in more often with hip pain because it's better diagnosed, I think, by doctors at this time and by imaging. Where before the hip used to be kind of a no man's zone or a lost, and the only really thing you could do was the medical thing was a hip replacement. Now there's so many alternatives in treatments, conservative treatments such as physical therapy, injections, PRP, stem cell, before you even get to that surgical point. What I do find in my practice is, runners. We have a lot of marathon, half marathon runners. Hip is a very congruent joint. It's taking a load constantly. Every time you land on your heel and you're doing repetitive running, a lot of hockey players have muscles that come in and attach to the hip, and they put such a load on these muscles repeatedly that you end up with some hip issues because these muscles are causing also compressive forces in these joints. So I've been seeing labral tears due to repetitive injuries, joint irritation, and also adductor, abductor. There are 4 muscle groups mainly around the hip that can get tight, can be addressed with stretching, and also if there's imbalances, they can be strengthened or have a home exercise program or gym program to strengthen for those injuries. So what do you think about that, Dr. Pierce?
Well, that's how do I compete with that? No, I mean, you're right. I mean, the hip, like even with Draper last week, I don't know if anybody caught the little discussion Drapes and I had, but, he brought up hockey players, and he has so much strength around that joint. And as you age, you're getting an aging process on that hip, the hip joint itself, kind of like the other ball and socket as opposed to your shoulder. And the anatomy, like you said, the imaging, which I'm glad you brought that point up. The imaging that we have now, we have MRI. We've had MRI for years. Our technology, the software of what we're seeing in detail is coming out. So we're picking up all these labral tears. People are saying the groin injuries, a lot of them are hip injuries because you're getting that referred pain, which we really didn't talk about. So the hip pain may show up as a groin referral pain, which we need to pay attention to, which before we would just, it's a groin injury, it's going to heal, and we're missing the hip. And the proper diagnosis, I think the docs are getting better at it, and we are doing a better job, and we have more options. And everybody hears about your shoulder being scoped. Oh, what happened? Oh, I got my shoulder scoped. I was up and running in 2 weeks. We're getting better technology for the orthopedics out there that are getting better at scoping the hip and correcting these labral tears. But for my type of practice where it's non-surgical, I mean, I don't want to keep pushing the stem cell, but I just see so much promise. We're seeing so much growth with it. And if we can create that prevention, then we're seeing less problems down the road. So for the listeners that are out there, I had a little hip once, a limp once in a while. Those are the things we want to start talking about. And it may not just be getting the stem cell treatment right then, but if we can do storage of your stem cells at your mid-20s to 30s, we might be preventing that early hip injury at your 50s and 60s.
248-539-9797. Let's go to the phone lines. We have Lori on a cell. Lori, how are you today?
Hi, I'm doing well. How are you?
Doing good. What's your question?
Well, my question is regarding my dad, who is 80 years old. He does not want to have hip surgery. And I'm just wondering what alternative treatments are available for individuals who are, up in age, such as himself. I'm familiar with the PRP. I've had that myself, and I loved it.
Oh, great.
But I'm just wondering what might be available for him.
Well, it's really going to come down to what his imaging shows and how bad it is. I mean, if it's a mild injury, there's a lot of things we can do. Like you said, PRP or stem cell. It's funny, I just had one of my orthopedic surgeons last week tell me that he's 80 plus years old and he thinks he saved himself a knee replacement with doing stem cell at this age. So, and he used his own stem cell. So a lot of times it could be as simple as what happens around the hip, which Dan can agree, is that you get weakness. As that hip becomes painful, you lose all the muscle structure around it. So it maybe is, seeing the proper doctor with alternatives where we get to look at his glute muscles, his butt muscles, the surrounding muscles around it to just see if we can strengthen it up to make it better. Show him a few techniques. Does he use a cane? Did we lose him?
Oh, she got off the line.
Okay.
Paulie's telling us over the glass she got off. Yeah.
All right. Well, that's a cell phone for you. But just to finish up, if he's not using a cane, taking a lot of people, especially, it sounds like her father had a lot of pride. They don't really want to use that cane, but sometimes using the cane, taking that pressure off the hip really makes a difference at a large level. So, we appreciate the call, but it's a great question.
Marissa.
Yes, and just to add to that also, I want to reiterate that taking the pressure off a hip that probably isn't a healthy hip, but also referring to function, I think it was Marissa, what does he want to accomplish and what are his goals? So certainly there are things like PRP that you talked about, but if he hasn't gone to physical therapy, which is conservative management, there might be some education about unweighting his joint and stuff that he can do at home, because basically to help heal or help decrease irritation of a hip joint, short of surgery, you just keep wanting to unweight it and let nutrition and any kind of healing that could possibly heal by taking weight off happen.
Well, this time for the local hero of the month here in last month we did the Ted Lindsay Foundation. This month, Starfish Family Services, and they work directly with children and their parents and caregivers in a family-focused environment. Their main location in Inkster, up in 16 other locations, or even during home visits. And let's get our guest on the line, Marissa Nicely, the Vice President of Clinical and Youth Services for Starfish Family Services. Marissa, good morning. Thanks for being with us on a Memorial Day weekend.
Good morning.
How are you?
Here. Hi, Dr. Pierce.
How are you?
Good. Is this where I do my testimonial about how you brought me back from a back injury without surgery?
Sure, we'll take that. But we wanted to talk about Starfish. But, it's a great lead-in to anything we want to talk about, honestly.
Right.
No, we did have issues with you. And maybe that's kind of how we met or at least we knew of each other, but we really grew close, and I became more affectionate about Starfish after being a patient. We've been participating, sponsoring you guys ever since. So I think you're doing great work. But yeah, I told you if I did get you better, you have to self-promote me and all that. So I'll commit to that.
Well, let's start right off. Let's start right off the bat with that, Marissa. What was it like working with Dr. Jeff Pierce?
It was amazing. Dr. Pierce really listened to me and my goals. This was about 12 years ago. I had an L4, L5, L5S1 injury, and he knew that I was pretty young and active, and he just really worked with me to get me back to my goals, which was running at the time. But you'll be happy to know that since then I have crossed over to less impact sports and less impact-oriented activities. But definitely a doctor who really listens and listened to where I wanted to be and got me there.
And that was not scripted at all. Thank you very much. But let's get. I appreciate, and I do. We I love that point, because we do kind of listen, and we're dealing with athletes, and our goal is always to get you back. And I, you don't want to bring up the shoe issue I always had with you either, though, right?
Right, exactly.
To get you out of your heels.
No, I actually wear flats a lot more now. It's like, as I'm getting older, I listen to your advice.
So let's talk about Starfish. I mean, I know we've been trying to promote and make awareness all month long, and I know we've shared a lot of stories over the time. But what do you want to get out for Starfish? I know you have a lot of events coming up, but and one thing about the people about Starfish, just before Marissa starts, I mean, these people have a different passion. It's amazing what they have. The patients your employees have, your therapists. I mean, thank God we have these type of people, because the rest of us wouldn't have the kind of patience that these people need, and tolerance, and just the love that you guys put out to these families that would otherwise, I think, truly be lost. And you guys, I mean, hats off to you guys, especially on Memorial Weekend. I mean, you guys have done an amazing job at a very difficult situation. So,
well, thank you, but this is what we do, and we love to do it. So, as you mentioned, we're a nonprofit focusing on serving children and families, and our mission is strengthening families to create brighter futures for children. We have locations in Western Wayne County and services throughout Wayne County in three main areas of focus: so early childhood education, mental health, and then programs for parents and families. And I know in the past couple of weeks you've talked about the agency as a whole and our volunteer opportunities and community outreach. But as the Vice President of Clinical and Youth, I kind of wanted to talk a little bit today about our efforts to bring awareness to the issue of childhood trauma and toxic stress. Are you aware? Have you ever heard about the term toxic stress as it relates to children?
Yeah, I mean, I don't. Again, I'm not trying to play off of it, but it's an aggressive term, and it's sad. And yeah, I mean, go ahead and explain it a little bit more for the listeners. But it's not a good thing.
Yeah, so basically recent research is showing and giving us a lot more information that when children are repeatedly exposed to trauma, so that can include violence, abuse, neglect, household dysfunction, their brain development is negatively affected, and this often results in trouble learning at school and trouble controlling their emotions.
So just to jump in, that's just not physical, that's verbal too, right?
Oh, absolutely. No, and mostly it's abuse, it's neglect, it's grief, it's loss. People experience trauma differently. What can be a traumatic event to one person might not be a traumatic event to the other person. It's something that really is related to the individual experience. But while for one child, the loss of a pet, for example, could be a traumatic experience, for another child, it might not be. And it really depends on how the environment around the trauma affects the child. And I can talk a little bit more about that. But one of the things that I want to talk about is how prolonged exposure to trauma can actually cause this condition that we call, which is toxic stress, which is basically the brain's fight or flight function, the body's fight or flight function constantly being activated, which can cause increased cortisol response and then inflammation. And what we found is that this actually is directly correlated to adulthood chronic illness, such as COPD, cancer, coronary heart disease. So really what's happening to our brain and how we're experiencing things emotionally directly impacts our physical health as we age. And studies are showing that 1 in 4 children have experienced at least one traumatic event by the time they reach us in preschool. But like I said earlier, the best way to mitigate this is a positive and supportive relationship with an adult. That's the best buffer to these adverse experiences that children are having to face.
Yeah,
so,
I mean that's it's a lot going on, but we're just running into a time issue. I want to talk about how to get involved, and I know we've put it out there a couple times. So, but we'll bring you on. What I want to do, because it is a serious topic, we may turn that into one of our weekly shows and to get a little bit more detail into that. But to get a hold and get involved, what's going on with Starfish right now, just so we can get that information out to the listeners.
Yeah, well, we definitely have our gala event coming up on June 8th. So we would love to have people attend and support our gala. And we also will be having several community education events coming up around the issue of trauma to bring awareness to our community members. All of those events will be listed on our website, starfishonline.org. So visit us on our website, and you'll see a lot of different ways to get involved if you want to learn more about this issue or any issue, and any way that you'd like to get involved in helping our community children and their parents.
Okay. Yeah. I want you to commit that we're going to get you in studio, and we'll get into where we can get into a longer segment and get into those issues, because I think it is interesting to the listeners and to understand what we're doing and the long-term effect to our loved ones. So I appreciate it, and have a great Memorial Weekend, and hope to see you soon. And take care of that back.
I will. Thank you.
Alrighty, that's Marissa Nicely, VP of Clinical and Youth Services at Starfish Family Services, for our local Hero of the Month segment. Let's go to Ed in Birmingham. Ed, good morning. Thanks for waking up with us today.
Yeah, I just wanted to, I had a hip replacement about 15 years ago, and just when I ride in a car for a long time, I get some a deep pain, and then it gets reflective into the groin area. I'm just wondering if there's a treatment for that. Immediately after getting out of the car, for 5 minutes later, it gets relieved, but just very difficult in long car rides. I guess all those nerves down there or something, but is there a treatment for that?
Well, you've had your hip 15 years now, the new hip?
Yeah, yes.
Yeah, so have they looked at it? I mean, anything over 15 years is a bonus.
Fine there.
Yeah.
Yeah.
Okay, well, we've probably, a lot of things, like you said, what's the definition of a long car ride? Is it 20 minutes?
Over an hour.
Yeah. So that could be it there. I mean, it could be change of position. It could be, you're weak around what we keep talking about is the core structure of your hip muscles. But Dan, anything?
Yeah, I'm interested to know the position. Obviously, his hip is in a flexed up position, and it's interesting that you're saying it's only when you're driving in a car for a prolonged period of time, like an hour. There could be soft tissue structures that could be causing that pain. Is there any other symptoms besides driving in a car and anterior hip pain that go along with that? You have good range of motion, everything?
Yeah, no, pretty good range of motion. Play golf and walk a golf course, and no, other than that, it's pretty solid.
And the other thing is the amount of time, 15 years. It might not even be anything related to surgery at this time. So I think to get it looked at by a professional, just to keep to see what is causing the pain. If it's just in the car, if a professional, a physical therapist, or a physician can recreate that pain, or see if there's any muscle imbalances, or again, any flexibility issues in the anterior hip too. It sounds like obviously something is irritating you in that position, and I'm certainly wondering. It makes me wonder how we could help you. If I could get my hands on you and see if I could reproduce that pain.
Let's keep it clean. It's early Sunday. Yeah, no, she's exactly right. I mean, you're kind of one of those in-betweens where it's hard to just figure out over the phone like this. And sometimes it is a matter of getting our hands on you, recreating it. And sometimes you could be avoiding, but it's true. You're in that forward flex position and the hips up, and it's kind of put at a disadvantage. And, the other thing is there's compression things. So is there a nerve involvement? Is there a back involvement? So there's a couple things we probably would like to look at, or at least have one of your physicians look at. But it sounds like it's more of a non-surgical. So you might want to go see like a sports med, or a good hands-on therapist to resolve that. But we truly appreciate your call, and if we're willing to kind of see you or see someone like us. But if it keeps going on, we want to kind of be preventative, and hey, we can even put the little stem cell or PRP in there. So.
Thanks, Ed. That's Ed in Birmingham. And what Dr. Jeff Pierce was referring to as play nice, of course, Dr. Dana Ponders has her area, and Dr. Jeff Pierce has his. And hey, Doc, I work for you. So Michigan Sports and Spine, 2 locations in Troy and Livonia. Troy Sports Center. If you do want to get in touch with Dr. Jeff Pierce, Michigan Sports and Spine.com. Coming up after this, looking forward to the next segment, Ben Bowler will join us for the Regenerative Medicine Minute, Chief Science Officer at Forever Labs. Taking your ticket text 97136. Got a few of them coming in here. We'll get to the next segment. Open phone lines talking hip today, 248-539-9797. Dr. Dana Ponders, Dr. Jeff Pierce. My name is Dominic Hennig. We'll be back after this.
Not all physical therapy and dinner. La Strada Dolce Cafe on Merrill Street in Birmingham.
The names you trust. The teams you love. 97.1 The Ticket.
You're listening to Inside Sports Medicine on 97.1 The Ticket.
Well, Dr. Jeff Pierce is here. Dr. Dana Ponders. My name is Dominic Hennig. Happy to have you along on a holiday weekend. Happy Memorial Day to you. It is Inside Sports Medicine. We do this every Sunday. This is week number 8, I believe. Every Sunday from 8 to 9 a.m. And again, happy to have you here. Let's go right back to the ticket text. We're talking about the hip pain today. If you have questions for either Dr. Jeff Pierce or Dr. Dana Ponders, they have 20 years plus of experience, each of them. Happy to take them here. Open phone lines, 248-539-9797. Ticket text 97136. This is from Bob in Troy, and this leads perfect into our next segment. Been a landscaper for 30 years. 2 torn rotator cuffs and torn labrums. My heart goes out for you. I went to a surgeon after the MRI. He said, quote, "It looks bad, but I'd rather not cut it at this point. If you agree with physical therapy and do it when and the way you're supposed to, we'll see what happens." He then went on to say 3 months of therapy, 3 days a week, and still doing the things I'm supposed to 5 years later and feel no pain. And that's from Bob in Troy, and I think that leads us into our next segment here.
This is the Inside Sports Medicine Regenerative Minute, sponsored by Forever Labs.
Well, Dr. Ben Bowler is in studio. And Doc, you said this leads right into it here. And of course, I'm not on your level when it comes to Regenerative Medicine Minute and stem cell PRP, but how does this relate to Bob in Troy, his text?
So just so I'm clear, he ended up doing the therapy for 3 months, and he's good 5 years later.
3 months of therapy, 3 days a week, and yeah, I'm doing what I'm supposed to 5 years later and feel no pain after not having surgery after 2 torn rotator cuffs and 2 labrum tears.
No, I mean, that's great. I mean, first of all, a testament to the surgeon who decided not to cut, and to the landscaper, Bob in Troy, that he committed to it. But I'm hoping that you're continuing to do those home exercises and staying active and preventative. But again, I mean, that is a great thing for our stem cell. I mean, regenerative, what is it? I mean, I'm glad we got Ben here today to kind of talk more from the technical, and I can keep it simple. But, you know, we've been talking about PRP. We're talking about stem cell. You're a perfect candidate. Here's a terrible injury. You've had the tears. We want to prevent it even further down the years. And are you a candidate for it? I think 100%. You would be 100% a candidate for stem cell. You know, you are pain-free now, but what can we do to prevent down the road? And Ben, I mean, we've seen this a lot. And if you're not going to do it now, you know, storing your stem cells. I mean, how important is that? If we can store your stem cells today, you know, it's going to be better than using your stem cells tomorrow, right?
Oh, for sure. And thanks for having me on again, guys. I really appreciate being here. I think was it Bob with the ticket text?
Yeah,
I think,
Bob and Troy.
You know, this is a guy who obviously had a nice result. I don't know if everyone could expect that same thing, as great as the physical therapists of the world are. And you know, we at Forever Labs are trying to encourage individuals to extract some stem cells while they're young so that they're available for treatment when they're old. And I think a guy who's been doing landscaping for 30 years would be a perfect candidate for someone who could kind of reach back in time and access some of the reservoir of youth that he had when he was starting his career, when he was in his 20s probably.
Right. So just let's talk a little bit about that. I mean, what's the difference? I mean, you heard me talk about my orthopedic surgeon that I trained under. He's 80 plus years old. Just used his stem cells at 80 plus years. But, if this is a young gentleman, he's got 30 years of landscaping, so he probably around his 40s to 50s. What's the difference if we get that stem cell at 25 and want to use it when we're 50? Can we truly say, you're going to prevent a hip replacement or a knee replacement?
Well, obviously every individual is different, but you can at least say that it's going to be a lot more likely to prevent those kind of severe medical interventions. The stem cells we're interested in come out of the bone marrow. And the bone marrow is, although it's a fluid, it's still an organ, just like every other organ system. So, when you get older, your kidneys go, your mind goes, your joints go, and your bone marrow is no different, where you have a kind of a complex system of cells and tissues interacting with each other. And just over time, you get degradation. So if you can take advantage of what we're offering, which is to save a small piece of that bone marrow, you can use it as a kind of what we like to consider a little bit of a fountain of youth as you get older, because it can be expanded and almost to infinity.
How? We keep saying save a small piece, and again, this is not where people who there's been the controversy of fetuses or abortion.
Oh, for sure.
It's not that bone marrow. This is completely different. How do you do that? How do you save a piece?
So pretty simple. So what we do is we go in through the.
I can jump in there.
Sure.
We're bone marrow. So just to explain, that's when you eat a steak or something, it's the fluid inside the bone. So what's the best place to get it? There's a couple places that we look at, but most commonly it comes from the hip, the largest bone in the body, and we take bone marrow out. And what we're doing is we're taking that fluid out of your own body.
How?
Well, we won't get into that.
Okay.
It's a simple. Let's just say it's a simple procedure, and you're in and out of the office.
It's a simple
15
procedure.
minutes.
There is a needle used. We're obviously piercing through the bone and pulling out fluid. And there's a way to do it, even in the delivery of how to get the bone marrow to preserve better cells is important. So it's not just like anybody's doing. You don't just stick a needle in, pull it out. There's a rotational. You want to get the most populated cells as possible. So there is a certain technique that's used, which is used in our practice, and most of the guys that are doing it on a regular basis, there's a certain technique that we're using where you're rotating the needle. But again, the big message is it's coming from you. There's a couple different ways, and I know people are getting a little controversial. Do I use donor cells? Do I use my own cells? Am I too old for it? Right now, my opinion, and as of today, is to use your own cells. I don't know, Ben, I think we've talked about this off the air, and we believe that that's still the best way to store your own cells and to utilize your own cells. So
we're certainly on the same page with that. I mean, the difference between donor cells and your own cells is pretty large. There are certain applications for which you could use a donor cell, but the kind of genetic differences between you and not you are large enough that your body's going to recognize donor cells, and even if it doesn't cause any kind of serious immune problem, it's certainly going to degrade and reject those cells eventually. And using your own cells, what's going to happen is the cells are going to integrate back into the tissue and cause repair. In the sports medicine is a great example. These cells can be used for a lot of different issues. My expertise is actually in neurologic diseases, but sports medicine is really where they've kind of had the most clinical use in recent years.
And a lot of success. I mean, we're seeing
Absolutely.
a lot of success with it. And that's another thing we want to talk about, the importance of storing the cells is, we're not just talking about sports. Obviously this is sports radio, and we're talking about sports injuries, but, there's unfortunate things. Again, we bring up the Gordie Howe, which is probably the most publicized in our area, was his neurological issues with his stroke. And if we are getting diagnosed down the road with something that is very unfortunate from MS to, all these other neurological issues, you have another option of treatment. You're putting something else to benefit you for an option of treatment down the road.
And frankly, I just like to jump in and say it's not another option. It's really it's going to be the only option because, if you're unfortunate enough to have a stroke or a severe traumatic brain injury, like you have rehab and you have nothing if you don't get to the ER in a really, really quick time period. So this is going to be a treatment option going forward that gives someone, hope, which is the best you can offer to any patient, I think.
And Doc, you do this, correct, at Michigan Sports and Spine?
Yes, we did this. Yeah, we're doing it. We're excited. It's really rebirthing me. Like you mentioned, which I don't love, that I've been out for 20 years now, but this we don't walk in with walkers and stuff like that. I'm still walking pretty well, but
good.
This is what's really, thanks. This is really what's getting me excited again about medicine. I've always had this, what can we do to prevent it? I've always been the guy preventing. My reputation is I'm the guy who tries to keep you from surgery. What else can we do? And this is just another tool we have. And he's right. Maybe the only options. Unfortunately, because of the stars, the big athletes, we're getting a lot of press and a lot of good research coming out of it. But it's not just for the high-end athletes. It's really for everybody, which we're treating now, which is exciting for the office.
And I think that's, you and other sports medicine doctors and a lot of orthopedic surgeons starting to offer these treatments more regularly. I think there's two really great benefits to that. First of all, just raising consciousness so people know that they have this other option. And second of all, it's really driving the price down, which I think is really a great thing for patients. The companies that make the equipment necessary have really been able to start to offer it at prices that are reachable to, a landscaper, say,
We'll take a text 97136. This comes in, Doc. What is the average price? Say I'm 25, 30 years old. I want to go into my bone and store a stem cell, from bone marrow. How much does it cost, and how long is the procedure or process from start to finish? I know you said.
So I think I can feel that one pretty.
Minutes.
Yeah. Okay. So at Forever Labs, $3,500 is the price to store your cells, to have them extracted.
Forever.
Yeah, so there's a small maintenance fee yearly, but it's nominal compared to that. And you're in and out of the office in less than an hour. The procedure itself is maybe 10 minutes.
And you do the procedures at Michigan Sports and Spine, Doc.
Right. And it is. People think they're up for a day. You're basically walking in and walking out with hopefully just a little Band-Aid.
I've had it done twice, and I haven't missed work either day. Let me say it that way.
And then say something goes wrong in the future, you could go to your, I guess, quote-unquote bank, right? Which would be held at Forever Labs.
Absolutely.
And then that helps in your next procedure.
Absolutely. And, like Dr. Pierce brought up, Gordie Howe, was in his 80s, and his former mentor was in his 80s, and they had successful stem cell therapies. Those are great stories. That's not going to be the case for everyone. Obviously, the younger the material, the higher chance of success you're going to have. And in medicine, you always need to talk about, the chances of success for a treatment rather than this will work or this won't work. So
back to the ticket text here at 97136. Where would my stem cells be stored?
So they're stored in an FDA maintained, an FDA inspected, highly regulated biobank, which we actually run by a partner company of ours, but very, very safe, very secure. Tons of redundant systems in place. So your cells, once they're out of your body, they are not going to degrade.
Alrighty, that was James. How about this one? Hi, yes, I work in construction. I have 3 discs out in my lower back. All doctors won't operate, and I'm in pain every day. Is there anything that would help?
Well, yeah, there's a lot of things that can help. I don't know if you've done rehab already, but 3 discs, to what level? Are you having leg pain? There's a lot of questions we ask. That would be a great question for last week, but to kind of tie it into this week, we're worried about that. We're worried about prevention. And it's good that they're not doing surgery, so it tells me that you have no surgical emergencies. It's really like when you come into the office, that's what we look for. Do you have any surgical emergencies that we have to deal with? And probably 99% of the time they don't. One, because possibly I'm a non-surgical physician, but for the most part, there's a lot we can do. It's going to be time consuming. So it's not like we have a magic wand when you walk in and here's the pill. You're going to have to commit to a home exercise program, a therapy program, figure out what simple medications we can take. We are starting to do stem cells. There's a lot of people doing stem cells for disc. There's a good of research coming out for disc itself, because we'll get into the anatomy of it, but putting some stem cells in what we call the matrix of the disc, which is the cushy part of the spine. We're seeing really good results with healing with scar tissue and actually increasing some of the height to the disc itself.
And that's one of the great things about these kind of bone marrow-based stem cell therapies is they do a number of things. One of the things that they've really been shown to do and proven to do is to get in there and kind of degrade the scar tissue and give the body room to heal itself, which is a big problem in joint injuries and in, after heart attacks, any kind of really traumatic injury. You're going to get a layer of scar tissue that really prevents the body from healing in the way it wants to heal. And that's actually one of the main ways in which stem cells can be beneficial, is by getting in there and kind of reprogram the immune system to kind of degrade that scar tissue and promote the natural healing that should take place in the healthy situation.
Right. So, it is exciting. We're seeing, again, just to simplify, because I know we're coming to the end here, when you take your stem cells, we're just real simple again for the listeners, you're taking the stem cells from your body, from your bone marrow, ideally from the hip. It's a simple procedure, and we're spinning that down. We're taking out all the good healing properties, including the stem cells, re-injecting into the injured area. And this week, we're talking about hip. We'd be injecting into the hip joint. We may be for the labrum, which is the tight little ligaments within the hip. And we're seeing results. So what are our results? Our results are just that, cutting down the inflammation, which what steroid does. It cuts down the inflammation, but it's also creating the healing properties. It starts laying out the matrix for regrowth. And then what we're doing is we're coming back there with PRP. So again, my simplicity of it is that the stem cell lays the seed for the growth, and then we fertilize it with the PRP. And we're seeing results. They don't happen instantly. They happen over, like I said, 3 to 6 months. We continue to see regeneration of it. So it's a great thing. Ben, any final words on that?
I just wanted to bring up the point, too, that, obviously the patient feeling better is the most important thing. But that you can always have biases and, I did something great and there's a placebo effect. But, these are real results that you can measure on imaging, as Dana brought up earlier, And you treat a joint and you can watch the cartilage regrow over the course of 3-6 months, like you said. And so,
right.
There's a quantifiable healing that takes place, which I think is very important to note.
So I think, from our response, I appreciate you coming in. I know we brought you in again. But what we're getting from our listeners is this is a big interest. And what we're going to do is we're going to start doing monthly talks. We want to hear from the listeners. What do you want to hear from our sports medicine, from our stem cell? I know we're running to a holiday week. I want to say happy Memorial Day to all the listeners out there, and enjoy the day. Dom, take over.
Dr. Dana Ponders, can you believe it's 9 o'clock? Dr. Dana Ponders, thanks for coming in again.
Thank you for having me this weekend on holiday, and a shout out to my brother who has a big 57th birthday from Dallas, Texas. Ron, I love you.
Yeah, I know you wanted that one. Ben, thanks for being here today, buddy.
Well, it's always a pleasure. Anytime you want to have me back, I'm happy to come.
Well, if you're new to this, I know a lot of people move back to Michigan from the South here on this weekend. If you are new to the show, it's called Inside Sports Medicine. We do this every Sunday from 8 to 9 a.m. This is week number 8. We talked about the hip this week. Next week, we're talking about the neck. We do medical minutes, regenerative medicine minutes. We do a celebrity guest. We've had George Gervin on, Ted Lindsay, Tommy Hearns, Jimmy Howard, Fedorov, Igor Lirianov, Chris Draper. Is Dom Raiola on next week?
No, he's in 2 weeks. We got Kim Hurst coming in as our special guest for our new local hero. She's going to be our local hero next month.
So we have fun every Sunday from 8 to 9 a.m. right here on 97.1 The Ticket. For Dr. Dana Ponders, Ben Bowler, Dr. Jeff Pierce, my name is Dominic Hennig, saying have a great Memorial Day weekend, everybody.